Adenomyosis is a condition in which endometrial gland develops deep within myometrium. That condition is known as adenomyosis. It is also known as internal endometriosis, and it is common in multiparous women in their late 30s and 40s. Its pathogenesis is ectopic endometrium within myometrium, results to cyclic hormonal change and results in bleeding within myometrium. Its pattern are of two types: diffuse pattern and focal involvement. In diffuse pattern is most common, while in focal involvement, focal pattern presents with mass and adenomyoma. That is known as adenomyosis. Its symptoms are asymptomatic pain with severe cyclic dysmenorrhea. Painful menstruation is most common type of the presentation, along with heavy menstrual bleeding and menorrhagia. This perineia means painful sexual activity is also a common presentation. So do not be confused with fibroids, because fibroids are also present with heavy menstrual bleeding, menorrhagia, and they also present with the enlargement of the uterus. But in adenomyosis, uterus is painful when touched. It is tender, while in fibroids, uterus is non-tender and asymmetrically enlarged. So this is differentiating point. Now, diagnosis and treatment of adenomyosis is ultrasound is the best initial test, and MRI is investigation of the choice. Enlarged globular uterus without well-defined mass and ill-defined endometrial myoma interference will be there. So histopathological test is definitive test, and examination is helpful to differentiate between fibroids and adenomyosis. In adenomyosis, symmetrical enlargement of the uterus occurs. In fibroids, asymmetrical enlargement occurs. And adenomyosis are soft while fibroids are firm, and adenomyosis is tender and fibroids are non-tender. So in this way we can differentiate adenomyosis from fibroids. Now the treatment of the adenomyosis is induction of amenorrhea, means we have to induce amenorrhea by GnRH analog, by long acting contraceptives like levogestrone and depo Provera. C-section is the treatment result in recurrence, and definitive treatment is hysterectomy. Removal of the uterus is definitive treatment for adenomyosis. So in this figure you can see the endometrial glands deep within myometrium are present, which results in bleeding, heavy menstrual bleeding, painful sexual activity, and menorrhagia will be there. So the involvement of myometrium by endometrial glands is present with this. So this was adenomyosis, and in next video we will discuss miscarriage.